We have been treating all kind of orthopedic problems here. Fractures are generally we get in emergencies, we treat them as the requirement is. Apart from that, we get all kind of patients. We have been doing knee replacement surgeries, hip replacement surgeries, shoulder replacement, all kind of sports injuries. If you are suffering from constant pain, which is troubling you for your daily routine activities, you need regular painkillers, it's affecting your quality of life, you are not able to handle even your daily course. So that's the time when you must think about the knee replacement. Total knee replacement is one of the most common and successful procedures being done in orthopedics today. And it has made a huge difference in quality of life of the patients of elderly age group where they were not able to walk even few steps. These days, the design and the material of the knee implants has improved a lot. The design of the knee implant has been made to meet the normal anatomy of the knee, where the shape of the knee joint, these days the implants have been designed according to that shape so that they fit better. We have been doing minimal invasive surgeries for knee replacement as well as for hip replacement, where the incisions, the cuts were quite big initially. Now we have been doing the smaller, almost half of size of the cuts, where the blood loss is less, the recovery is very fast, and patient gets back to their normal life very soon. People they want to live quality of life. They don't want to walk with a limp gait or a waddling gait. They want a good quality of life. If they get osteoarthritis and changes in the knee joint and they have to live till 80, they get these changes at 55, 60. They don't want to live with waddling gait and with painful and deformed knees. About the hospital itself, about the infrastructure, about the equipment we have in operation theaters is state of the art, up to the mark with today's standards. We have all major equipments to handle any kind of orthopedic surgeries here. Yeah, post-operative rehabilitation after surgery, after any surgery is very important. Especially in knee replacement surgery where patient has to start walking on the new joints with all balance and all rehabilitation processes. So it becomes really important to follow that and to follow it with all latest techniques and guidance. In this, IBS has taken a very important and advanced step where we have a robotic cyberdyne which guides us for a better outcome and rehabilitation processes after any surgery, and especially where gait training, balancing the body is there, it helps a lot. So we have been using that for past quite years, and results have been really encouraging if we compare it with normal rehabilitation.